Hi, I'm Dr. Peter Lind. One of the things related to thyroid is hard to believe almost, but when the pituitary sends a hormone called thyroid releasing hormone to the thyroid gland begins to produce hormones that travel throughout the rest of the body. One of the main hormones is called T3, and this is the thyroid hormone. And it is the active form of the thyroid hormone, but it's not produced very much. T4 is produced like 90% of the whole thyroid hormones, and T4 is converted to T3, and most of that takes place in the gastrointestinal system. So that's what I want to talk to you about, is your gastrointestinal system and how important it is for your thyroid health. If your gastrointestinal system is if some of the symptoms are constipation and diarrhea, indigestion, you eat food and you're burping and you're belching and you just feel full, or even pain, abdominal pain, these are symptoms of a possible serious gastrointestinal problem. One of the problems that we find is there's a lack of acid or stomach acid called hypochlorhydria. So on the metabolic assessment form that you will fill out, we're going to ask you questions related to your gastrointestinal system. And there's actually 5 categories because it's so important. These are the first 5 categories on this form that we're going to ask you. The first category relates to colon, and we're going to ask you questions about constipation and diarrhea. And oftentimes, gastrointestinal problems, we get an alteration of constipation and diarrhea. Constipation seems to be more common. So if you're constipated, you've got a blockage or a slowdown of the system, and you don't need drugs. You need to find out what's causing that problem of diarrhea or constipation and get the problem fixed. Along with, or another problem related to hypochlorhydria or stomach acid, is infections, and these are rampant. Helicobacter pylori is a bacteria that is very common, and if that bacteria isn't found and reduced or eliminated in the gastrointestinal system, you can't get better. You can't heal until that bacteria is eliminated. So there's a test you have to run for this particular bacteria. Another problem related to that is inflammation. This is a big problem with the foods that you tend to eat causing inflammation, and it moves into and affects the cardiovascular system. So the things that you're eating create inflammation. Inflammation runs rampant in the system, in your body, and puts tremendous pressure and stress on the cardiovascular system. So another test that we may run is called C-reactive protein, which measures the overall body's systemic rate of inflammation. And if you've got that high marker, it has to be calmed down. Back to the stomach and small intestine, with the conversion of T4 to T3, which is thyroid, most and many of the neurotransmitters are produced, like serotonin, in the gut. And so if you have gastrointestinal problems, you're not able to produce the correct neurotransmitters, and so that's going to affect your mood. Depression, anxiety, moodiness, these are all related to neurotransmitters that are not firing correctly, but they're not being made correctly, and that happens in the gastrointestinal system. So we want to find out what's going on. We're going to ask you questions, and this will lead us into the path of the testing that we'll do, running large metabolic panels to find out what direction and problems you have. And then we can put a course of care on, and many times these are long-term problems that take a long time to heal, but you got to do it right or the body cannot heal and you can't get well. So hope this information has been valuable and important for you. And then we'll start with a metabolic assessment form, we'll move into the testing, and then we'll find the correct program of care for you and get your life back together again. So I'm Dr. P.